Good morning, everyone. Thank you so much for joining us this morning for this live Q&A session with Dr. Gagandeep Kang on COVID vaccine. As India faces its second wave of COVID-19, we are clocking in the world's highest number of new cases each day, and our health infrastructure is struggling to meet this unprecedented amount of pressure and tackling the crisis. We do have a lot of questions around vaccines. We know that vaccines have proven to be an effective tool for pandemic management. However, there are a lot of questions and misinformation around vaccines. So today, we bring IAVI and DBT Wellcome Trust India Alliance brings you a special Q&A session about COVID-19 vaccine with noted public health microbiologist, Professor Gagandeep Kang. Professor Gagandeep Kang is a medical scientist, a key contributor to the understanding of diarrheal diseases, rotavirus epidemiology, and vaccinology in India. She is currently at the Wellcome Trust Research Laboratory, Division of Gastrointestinal Sciences at CMC Vellore. She's also one of the first women in India working in India to be elected at the Royal Society of UK, and also chair of the National Technical Advisory Group for Immunization and vice chair for CEPI. A big thank you, Dr. Kang, for joining us on such a short notice and for agreeing to address some of these questions around vaccine hesitancy. This will be a short session, a 30-minute session. We'll be taking a lot of live questions. We've already received a lot of questions. And just a very quick thing before we begin, this webinar will be recorded and shared widely. There is question box that you can see in the panel, so please feel free to submit your questions anytime in the question box. In case there is a technical glitch and you see the webinar ending abruptly, please feel free to relog in using the registration link. And the panelists, providing their views of the current situation are experts, and they're not speaking on behalf of the government or associated organizations. Thank you so much, Dr. Kang, for agreeing to do this. I'm going to probably straight away dive into the questions. And what we've been constantly hearing from people is, how does a COVID vaccine work? If you can help break it down for people, and also talk a bit about what are the different vaccines that are available and any contraindications of those vaccines that we've seen.
So all vaccines work in the same way. They essentially pretend infections. So what you're trying to do is get the body to think that it is infected and make an immune response. And you can do that by giving the whole infectious organism, bacteria, viruses, etc., or by giving a part of it. Or in the new vaccines, we teach the body to think that it is infected and it needs to make a response to the infectious agent, to the foreign thing that has come in. And vaccines since 1796 with the smallpox vaccine have all functioned in exactly that way. A pretend infection that does not make you sick, but induces an immune response that protects you. If we want to cover the same thing in Hindi, जब हम टीका लेते हैं तो ऐसा लगता है कि जो भी कृमाणु हमें बीमार बनाता है वही कृमाणु अंदर आ गया है, और हमारा शरीर फिर एक इम्यून रिस्पॉन्स बनाता है, एंटीबॉडीज बनाता है जो हमें बीमारी से बचा सकते हैं. तो सारी वैक्सीन, सारे टीके ऐसे ही काम करते हैं. शरीर को लगता है कि कोई कृमाणु अंदर आया है जो यहाँ पे होना चाहिए और उसे निकालने की कोशिश करता है. और अगर हम टीके लेते हैं तो हम बीमार नहीं होते हैं, और अगर इन्फेक्शन हो जाता है तो इन्फेक्शन के साथ बीमारी भी हो जाती है जो थोड़ी अनप्रिडिक्टेबल रहती है. हमें पता नहीं है कि ये बीमारी बहुत गंभीर हो जाएगी या नहीं. टीके लगाने का ये एडवांटेज रहता है कि हम जानते हैं कि इससे बीमारी ज्यादा सीरियस नहीं होगी.
थैंक यू डॉक्टर कांग. आई थिंक एक सवाल जो हमें बार बार आता है इसकी, इस वायरस के कितने स्ट्रेन करंटली इंडिया में एक्टिव हैं. what is the data that currently suggests whether the vaccines currently available are providing immunity against all the available current strains. Uske upar if you can give us some understanding.
ये वायरस जो है एक आरएनए वायरस है, और आरएनए वायरसेस बहुत ही जल्दी बदलते हैं। और ये बदलाव का क्या होता है, कभी कभी कुछ भी नहीं होता है। जब हम एक कहानी पढ़ रहे होते हैं तो एक शब्द अगर उससे निकल जाए या बदल जाए, कहानी की का अर्थ तो बदलता नहीं है। वैसे ही वायरसेस में अगर एक जो बेस है, एक न्यूक्लियोटाइड है, वो बदल जाता है तो ज्यादातर कुछ नहीं होता है। पर कभी कभार ऐसा भी होता है कि ये बदलाव से ये वायरस ज्यादा इन्फेक्शियस हो जाता है, बहुत ही आसानी से फैल सकता है। तो इस कारण हमें देखना चाहिए कि हमारे देश में कितने वेरिएंट्स हैं, और इन वेरिएंट्स का असर क्या होता है बीमारी पे, इंडिविजुअल लेवल पे और पूरी पॉपुलेशन में। और अगर ऐसा होता है कि ये जो वेरिएंट है बहुत ही आसानी से फैल सकता है, तब ये सिचुएशन हो जाती है जैसे हमारे पास अभी है, जहाँ पे ये B1617 वेरिएंट जो है बहुत ही आसानी से पूरे देश में अब फैल गया है। इसके पहले थोड़े इम्पोर्टेड वेरिएंट्स थे, जो ज्यादातर जो वेरिएंट हमारे पास था वो B117 था, जो यूके में पहले डिस्क्राइब किया गया था। पर अगर हम देखें कि कितने वेरिएंट्स हैं इस देश में, हमें पता नहीं है, क्योंकि हमने इतनी सीक्वेंसिंग नहीं की है। पर वेरिएंट्स बहुत हो सकते हैं, पर कॉन्सिक्वेंशियल वेरिएंट्स ऑफ कंसर्न बहुत ही कम है। अभी हम जानते हैं कि हमारे पास यूके वेरिएंट है जो ज्यादा है, ये आसानी से फैलता है। B1617 है जो इंडियन वेरिएंट है, पहले डबल म्यूटेंट कहते थे, वो वाला भी बहुत ही आसानी से फैलता है। फिर साउथ अफ्रीकन B1351 है, और P1 ब्राजीलियन वेरिएंट है। B1351 और P1 बहुत ही कम केसेस के बारे में हम जानते हैं हमारे देश में, पर इनका नतीजा ये रहता है कि B1351 पे अगर वो स्ट्रेन हो तो वैक्सीन्स इतना अच्छा काम नहीं करती हैं, काम करती हैं पर ब्रेक थ्रू इन्फेक्शंस ज्यादा रहती हैं उस स्ट्रेन के साथ।
Dr. Kang, currently, what are the vaccines that are available in India? What is their proven efficacy, and how, what is the data suggesting in terms of how effective they are in sort of supporting the current strains and the future mutations that might come?
तो अभी जो वैक्सीन्स हैं भारत में, कोविशील्ड एक है जो सीरम इंस्टीट्यूट बना रही है, और ये विश्व में एस्ट्राजेनेका वैक्सीन के नाम से जाता है। और कोवैक्सिन है जो भारत बायोटेक बना रही है, ये एक इनएक्टिवेटेड वैक्सीन है, मतलब कि ये वायरस को उगा के केमिकली ट्रीट किया है ताकि ये वायरस इसके बाद फैल नहीं पाएगा, मल्टीप्लाई नहीं करेगा। इसे कहते हैं नॉन रेप्लिकेशन और इनएक्टिवेशन ऑफ द वायरस। और जो कोविशील्ड है वो एक एडेनोवायरस वेक्टर्ड वैक्सीन है, जहाँ पे एक और वायरस को लेकर उस वायरस में सार्स कोरोना वायरस 2 की जीन डाली हुई है, ताकि जब इन्फेक्शन हो जाए, जिसे भी इंजेक्शन हो जाए, जिसे भी वैक्सीन दिया है, टीका दिया है, वो SARS-CoV-2 का स्पाइक प्रोटीन बना सके। और जब हमारा शरीर देखता है कि ये स्पाइक प्रोटीन है तो समझता है कि इन्फेक्शन हो गई है और इम्यून रिस्पॉन्स बनाता है। कोवैक्सिन में पूरा वायरस दिया जाता है। अब हम देख रहे हैं कि गामालेया का अप्रूवल दिया गया है, और इसकी स्पुतनिक वैक्सीन जो है वो इंपोर्ट की जाएगी। वो भी एक एडेनोवायरस वेक्टर्ड वैक्सीन है। और इसके बाद और भी वैक्सीन आएंगी। जाइडस कैडिला एक डीएनए वैक्सीन बना रहा है, बायोलॉजिकल ई एक प्रोटीन वैक्सीन बना रहे हैं। तो बहुत सारी वैक्सीन हो जाएंगी, पर अभी 3-4 महीने लगेंगे उन वैक्सीन को आने के लिए। दोनों वैक्सीन अच्छा काम करती हैं। हम अभी तक जानते हैं, हमारे पास कोविशील्ड के बारे में थोड़ा ज्यादा डेटा है, क्योंकि ये वैक्सीन बाहर भी इस्तेमाल हो रही है और ये वैक्सीन बहुत ही अच्छा काम कर रही है। एक डोज भी लेने से 3 महीने के लिए 70-80% प्रोटेक्शन रहती है बहुत सीरियस या सिवियर इलनेस के लिए। और कोवैक्सिन के लिए हमारे पास एक डोज का डेटा नहीं है, पर 2 डोजेस अगर ले तो उससे भी, जो इंटरिम एनालिसिस है हमारे पास, उससे भी 80% प्रोटेक्शन होती है। तो इन वैक्सीन्स को लेना बहुत ही जरूरी है। बहुत सी मिस इन्फॉर्मेशन और डिसइंफॉर्मेशन है इन वैक्सीन्स के बारे में। बहुत लोग कहते हैं कि ये वैक्सीन्स बहुत ही खतरनाक हैं, बहुत असर होते हैं इन वैक्सीन्स के, पर ये सब हम देख रहे हैं और ज्यादातर ये सच नहीं है। एस्ट्राजेनेका या कोविशील्ड के वैक्सीन के बारे में बहुत लोग कह रहे हैं कि क्लॉटिंग डिसऑर्डर हो जाता है इसके साथ। हमें याद रखना चाहिए कि क्लॉटिंग के साथ, क्लॉटिंग या थ्रोम्बोसिस जब होता है तो ये बहुत ही कॉमन रहता है। जब हमें हार्ट अटैक हो रहा है तो हार्ट अटैक इस क्लॉट के कारण हो सकता है, पल्मोनरी एम्बोलिज्म हो सकता है, स्ट्रोक किसी को होता है तो शायद क्लॉट के वजह से हुआ होगा। ये तो आमतौर भी होते हैं, पर वैक्सीन के साथ जो रिलेटेड है इफेक्ट है वो है थ्रोम्बोसिस विद थ्रोम्बोसाइटोपेनिया सिंड्रोम। और उसका मतलब ये है क्लॉट के साथ लो प्लेटलेट काउंट होना चाहिए। और ये लो प्लेटलेट काउंट इसलिए होता है कि हम एक एंटीबॉडी बनाते हैं जिसे कहते हैं एंटीबॉडी टू प्लेटलेट फैक्टर 4। एंड व्हेन यू हैव एंटीबॉडी टू प्लेटलेट फैक्टर 4, उसके साथ you get clumping of platelets, and that leads to the formation of a large clot that blocks large blood vessels in the brain and the abdomen. So इसे कहते हैं cerebral venous sinus thrombosis या splanchnic vein thrombosis. So पेट में या सिर में बहुत सारे बड़े वीनस चैनल्स होते हैं और ये क्लॉट्स उनमें होते हैं और इनके साथ लो प्लेटलेट काउंट होता है। और ये होता है 1 लाख में एक को या 2 लाख में एक जन को। तो ये कॉमन, बिल्कुल ही कॉमन नहीं है। बहुत लोग समझते हैं कि अगर मैं वैक्सीन लूं तो ये मुझे हो जाएगा। आपको ये सोचना पड़ता है कि इसकी इतनी प्रोबेबिलिटी है कि लॉटरी जीतने की प्रोबेबिलिटी वही है। तो बहुत ही रेयर साइड इफेक्ट्स हैं और ये हमें समझना चाहिए और ये दूसरों को कम्युनिकेट भी करना चाहिए कि रेयर साइड इफेक्ट्स हैं। अगर बीमारी हो जाए तो उससे सीरियस इन्फेक्शन होने की लाइक्लीहुड या प्रोबेबिलिटी बहुत ही ज्यादा है।
थैंक यू डॉक्टर कांग। आई थिंक ये एक सवाल है जो बार बार keeps coming back to us. Since we are on this, I think कुछ सवाल और भी हैं जो हमें बार बार आ रहे हैं, which includes कि people who have HIV, TB or autoimmune disorders, renal insufficiency, pulmonary diseases or other comorbidities, can they take vaccines? Have there been proven studies that vaccines are safe for them? Also, for pregnant and breastfeeding women, can they take vaccines? If you can help answer these questions.
So it's actually more important for people who have diabetes and other illnesses to take the vaccines, because the chances of severe disease and mortality are much higher in people who have diabetes and hypertension. There is no contraindication to taking the vaccines. whenever you get an opportunity to take the vaccine, take the vaccine. The only time that you do not take the vaccine is when you're actually sick, because you don't want to have the side effects of the vaccine on top of your existing illness. And the second is if you have a bad reaction to your first dose, and bad reaction means anaphylaxis, very bad allergic reaction, not a little bit of fever, headache, tiredness, right? When you have that, then don't take the second dose of the vaccine. तो हम ये समझें कि कब वैक्सीन नहीं लेनी चाहिए, तब नहीं लेनी चाहिए जब हम अभी बीमार हैं, और उस वक्त नहीं लेनी चाहिए, और अगर पहले टीके के साथ बहुत ही ज्यादा एलर्जिक रिएक्शन रहती है, तब दूसरा डोज नहीं लेना चाहिए. डायबिटीज होने से, एस्थमा होने से, HIV होने से, इसमें कोई कॉन्ट्राइंडिकेशन नहीं रहती है. इन लोगों को वैक्सीन लेनी चाहिए. आपने पूछा था कि प्रेगनेंसी और लैक्टेशन में वैक्सीन लेनी चाहिए या नहीं. पहले लोगों ने ये सोचा था कि हमने प्रेग्नेंट विमेन, लैक्टेटिंग विमेन को ट्रायल्स में नहीं एनरोल किया था, तो हमें ये नहीं पता है कि ये वैक्सीन सेफ रहेंगी या नहीं. एफिकेसी का डाउट नहीं रहता है, पर सेफ्टी का रहता है. हम ये भी जानते हैं कि जब भी हम इनएक्टिवेटेड वैक्सीन लेते हैं, तब प्रेगनेंसी में कोई साइड इफेक्ट्स नहीं होते हैं. जैसे कि येलो फीवर वैक्सीन है, टेटनस टॉक्सॉइड हम प्रेगनेंसी में देते हैं, ये सारी इनएक्टिवेटेड वैक्सीन्स के इक्विवेलेंट है. और जो वैक्सीन्स हमारे पास अभी हैं, कोविशील्ड, कोवैक्सिन, जो नई वैक्सीन्स अभी आ रही हैं, इनको भी हम ये समझ सकते हैं कि ये इनएक्टिवेटेड वैक्सीन्स के इक्विवेलेंट है. अब हमारे पास डेटा है यूएस से, दूसरी जगहों से, जहाँ पे प्रेग्नेंट हेल्थ केयर वर्कर्स को वैक्सीन दी गई है और उनके अब बच्चे हो गए हैं. जिनको सेकेंड ट्राइमेस्टर, थर्ड ट्राइमेस्टर में वैक्सीन दी गई थी, उनके अब बच्चे हो गए हैं. और हम ये जानते हैं कि कोई असर माँ पे या बच्चे पे नहीं हुआ है, और ये वैक्सीन्स को देना चाहिए. अभी तक एक ऑब्स्टेट्रिक्स एंड गायनेकोलॉजी की सोसाइटी है भारत में, इन्होंने भी रेकमेंड किया है कि ये वैक्सीन प्रेग्नेंट वुमेन और लैक्टेटिंग वुमेन को दी जानी चाहिए. अभी तक गवर्नमेंट की गाइडलाइंस नहीं चेंज हुई हैं, पर शायद चेंज हो जाएंगी.
Dr. Kang, is there a safe period during the pregnancy when the vaccine is more effective? या उस like आपने अभी बताया second trimester में या third trimester में दिया गया है. Any data on that or any guidance on that?
नहीं, मैंने कहा था कि जिन औरतों को सेकेंड और थर्ड ट्राइमेस्टर में वैक्सीन मिली थी, अब हम उन वैक्सीन का असर जानते हैं, क्योंकि उन लेडीज की डिलीवरीज हो गई हैं. जिनको वैक्सीन फर्स्ट ट्राइमेस्टर में मिला था, उनके अभी तक बच्चे पैदा नहीं हुए हैं. इसलिए हम ये नहीं जानते हैं, कि डेटा नहीं है, पर लग रहा है कि कोई असर नहीं होगा. तो जब भी आपको वैक्सीन मिलेगी, आपको लेनी चाहिए. There is no contraindication by date or semester of pregnancy. यूजुअली ट्रांसफर ऑफ एंटीबॉडीज, अगर आप सोच रहे हैं कि मुझे एंटीबॉडीज बना के बच्चे को देनी है, तब हम कहते हैं कि सेकेंड ट्राइमेस्टर या बिगनिंग ऑफ थर्ड ट्राइमेस्टर में अगर वैक्सीन ली, तब देर इज इनफ टाइम टू ट्रांसफर योर एंटीबॉडीज टू द बेबी. बट अदरवाइज नो कॉन्ट्राइंडिकेशंस रिगार्डिंग सेफ्टी with the stage of pregnancy.
Thank you, Dr. Kang. One of the questions that we also see is कि बहुत से लोग बोलते हैं कि हमने first dose of vaccination लिया, and before we could take the second vaccine, they become infected. Either they are testing positive or showing symptoms. दो सवाल है. One, when people are going to take the vaccine, any safety precaution that needs to be maintained there, because there also we are seeing that physical distancing is becoming a challenge. The other thing is that a lot of times, people might be asymptomatic and they've taken the vaccine, and then the symptoms have blown up. So in both the cases, what is it that, people can do or take precautions?
I think the limit that the government set on 100 vaccines per vaccination session was to limit the number of people who would crowd into an area. Now, we have seen that in many cases, what has happened is that the vaccination session itself is so crowded that when people become infected shortly after vaccination, they might very well have acquired it at the vaccination session. So wherever possible, मेंटेन फिजिकल डिस्टेंसिंग. जब आप टीका लगवाने के लिए जाते हैं तो ऐसी जगह में इंतजार कीजिए जहां पे बहुत सारे लोग नहीं हैं. I know it is challenging, especially when you have token numbers and people being called, etc. But stay outside as much as possible. Go in only for the minimum duration that you have to go in for to a vaccination session, because physical distancing will continue to be important till there is less virus circulating and till you have an immune response. And that immune response can take up to 3 weeks of one dose of Covishield and up to 2 weeks after the second dose of Covaxin to build up. So you have to remember, you are not invulnerable, you are not completely protected for some time after vaccination. So very important to continue the physical distancing. Now, the second thing is what happens if you were already infected, or you got exposed at the vaccination session, or you got exposed shortly after vaccination. What will happen is that your immune response to the vaccine and to the infection will overlap. So it will be not like I have been infected plus vaccinated, it will be like one or the other. We generally recommend 2 doses of vaccination, and the 2 doses of vaccination are based on immunogenicity data that shows that your response to the second dose is also pretty good. You make a response to the first dose and then you boost after the second dose. So getting that second dose is important, but because infection protects you for 7 months. Data just published in the Lancet from a study called the Siren study in the UK shows that for people who have had infection, there is 7 months of protection at 80%. So one infection acts as well as vaccination for at least 7 months. Okay. So the recommendation that the WHO has is that if you are infected, you can afford to wait 6 months to get your next dose of vaccine. So if you're worried that the crowded immunization session gave you the infection as well as one dose of the vaccine, wait 6 months before you get the second dose.
Great. I think that was going to be my next question, that what is the optimal gap between 2 shots? And I think we have sort of answered that.
So actually, Devi, let me take that in a little more detail, because I think from the immunology perspective, when we've looked at vaccines, the longer the gap, the better the immune response. So there is a question, when do I have the best protection? And the second is, how long does protection last? Now, if you give one dose, you may or may not have protection from that one dose. We know that there is protection from the mRNA vaccines, from the viral vectored vaccines, but with the inactivated vaccines, we seem to need both doses to get that protection. The other unanswered question is, even for the vaccines that show us good protection with a single dose, the mRNA and the AstraZeneca vaccine or adenovectored vaccine, is that good enough for all the variants? We don't know until we have all the variants and we have enough people vaccinated to assess that. that actually, if you want to have the most robust, longest term immune response, then the gap between vaccine doses should be 4 to 6 months. And this is based on studies of other vaccines. And for SARS-CoV-2, there are lots of unanswered questions because we didn't have the opportunity in trying to develop these vaccines so fast. We didn't have the opportunity to address the questions on the ideal gap. So some of this we are figuring out now that the vaccines are in wider use.
Right. Thank you, Dr. Kang. I think one of the questions that we see coming is also on herd immunity and how many waves do we anticipate? And given the vaccination crisis that we are seeing right now, uh, is there like what's the optimal level of vaccination that would be required? Is there a third booster dose also that might be required?
So this is asking me to predict the future and get it 100% right. Not going to happen. So I can just tell you what I think is likely, right? So with the shortage of vaccines, it's something to worry about at the moment. But I think by the end of this year, we will have a lot more vaccine available. And one thing that is very important for all of us to remember is that last year, this time, we thought we would be starting our vaccination program at this time, not looking at some countries having very high levels of coverage and other countries competing for that level of coverage. Now, in India, we've been rolling out our vaccination program slowly because production is slow. So the most important thing that we can do is make sure that we get as many people around us and ourselves vaccinated whenever vaccines are available. The priority groups are important because the priority groups will ensure that we have fewer deaths in people who are the most vulnerable. I know the young want to get out there and work and go about their normal lives, but we also have to understand that the risk is lower of severe disease and mortality is lower for younger people. So it's this balancing game we are playing. Enough vaccine, enough people getting covered. What does society do? So many people are sick right now. Can we vaccinate our way out of this particular wave? We can't vaccinate our way out of this particular wave because it takes us time to mount an immune response, and we don't have enough supply to be able to protect a substantial part of our population. But for the future, for the third wave, yes, we can look at ramping up vaccination and vaccine coverage as much as possible to attenuate the third wave. Will we get rid of the virus? I think that is very challenging without very, very high levels of coverage. And right now, we don't know if that is going to be achievable because with a pediatric immunization program, we managed to reach 90% after 3 decades of trying. So where will we get to with adult immunization? We don't know is the answer. So what will happen? It's possible that the virus will settle into a seasonal virus with 1 or 2 waves happening every year because survival of the virus and transmission is very much driven by environmental conditions. What that pattern will be, we won't know probably until sometime next year. You need 2-3 years of experience with an agent before you understand what the pattern of illness is with that agent. So in that time, if we vaccinate, we will reduce the size of the waves. So even if it happens, it may settle down to being nothing more than a very bad flu. That said, flu is a dangerous disease which we don't recognize. It kills a lot of people every year, particularly the elderly and the very young. So making sure that we continue to focus on vaccination and prevention is very important. How will variants play out into this? We don't know. Right now, with the variants that we have, the vaccines are working well. They work well against the UK variant. They work well against the P1 variant. They don't work as well against the B1351. The prediction based on data from Oxford is that most likely they will work reasonably well against the B1617 variant. What is very important for us to do now is to do vaccine effectiveness studies and do this by variant type. We need to understand, when we have given millions of doses of vaccines, how well are the vaccines working in our populations with the different variants we have circulating. Only way we can get that information is to have epidemiological information, vaccination information, and sequencing of the viruses that cause breakthrough infections. We don't currently have a systematic approach in the country to do this. It is an urgent need.
Right. Thank you, Dr. Kang. I know we've hit the time, but if we can take a couple of more questions, we have a few more coming in. So I think one of the questions that's coming in is, there's a lot of prediction about involvement of children in the third wave. Is there a scientific validity to that?
Children were involved in the first and second waves. What's going to happen? We are going to cover adults with vaccines, and children will not be covered till the adults are covered. So obviously what we will see then is that the proportion of cases in children will be different from the proportion that we have seen, that we will see in older age groups. So I don't think that children will start suddenly playing a special role in the pandemic. I think it will just be a consequence of the actions that we are taking to affect other parts of the population. Children are important in the transmission of most infections. They may not get sick themselves, but they carry viruses around. So I think ultimately we are going to be in a situation where we will need to vaccinate children. The US has already decided that it is going down to 12 years of age, and I think we will follow suit. An age descending strategy makes a lot of sense, and that is across the board. But I think the age descending strategy should be calibrated to the number of doses available so that the older people are covered earlier than younger people.
Thank you, Dr. Kang. We also see one question coming in where the person is asking that in the current situation, there is shortage of vaccines, especially in rural areas. Till vaccination is available, what is the other medication that can be taken for safer immunity?
None. So the one thing that I do advise people to do is to do deep breathing exercises. So especially, yoga has a range of breathing exercises that you can do that expand your lung capacity. And that is really important because it gives you more reserve in case you get sick. So the time to do them is when you're looking to prevent infection, not so much when you get sick.
Thank you, Dr. Kang. One more question I think that is there is that post one has taken a vaccination, are there things that one needs to be careful of, for example, wearing mask, or is there a possibility of seroconversion or transmitting the virus in any form?
So vaccines don't have live virus, so you can't transmit from the vaccine. However, if you are infected, then you can always transmit virus to other people. And you know that there is a proportion of people that can be infected even after vaccination. Vaccines are not intended to prevent infection. They are intended to prevent disease. However, there are studies that seem to show that there is actually pretty reasonable protection against infection and protection against transmission in households. So even in something like, households are a high transmission setting, and studies from the UK have shown that one dose of the AstraZeneca or the Pfizer vaccine has reduced transmission within households by 50%. So that goes to show that vaccines are directly and indirectly preventing infections.
Right. And Dr. Kang, if say a person has taken a vaccine first as the first dose, and now that the second person wants to take the second dose, but the vaccine that the person had taken earlier is not available, should the person take other vaccine, or how to go about that?
Right now, the advice is wait till the same vaccine is available. But there are currently ongoing studies in the UK again, which is kind of leading the world in many kinds of clinical and epidemiological science, that if you mix doses, what happens? And we should have results from those studies coming out in June and July, and that should inform our future decision making.
Right. I'm going to take one more question on plasma. So a lot of people have asked, can I donate plasma if I'm vaccinated or if I'm infected? Can you shed some light on the plasma thing?
Don't bother with plasma. There is one very small study that indicates that in a group of older individuals who received plasma within the first 3 days of getting symptoms, there was some benefit. Now, most people who wind up in hospital are not within their first 3 days of illness. Remember, what does your plasma contain if you are infected or vaccinated? It contains a certain amount of antibody. We don't know how much antibody, but let's say even if you have a lot of antibodies, when does a person reach hospital? A patient will reach hospital when the virus has multiplied a lot and the immune response has started to kick in and has resulted in a level of inflammation that is making people really, really sick. By that time, the virus replication is pretty much done. So when you give antibodies, the virus, it has finished its multiplication process. So what are your antibodies going to do? There's nothing for them to work on. So that's the issue. Antibodies are useful, but are useful in early illness. And this has been shown from that one plasma study. It's also been shown with studies of monoclonal antibodies, showing that you need to get in there really early to be able to prevent progression to severe disease. Once disease is already severe, then these have very little effect.
Thank you. Thank you so much, Dr. Kang. I know we've uh, passed the time by 8 minutes now. We still have some questions coming in, but for the audience, I just wanted to say that whatever we have heard today from Dr. Kang, we'll be preparing a FAQ list and sharing it widely. We will also try and take some of your questions back to the experts and see if we can get answers to it. Dr. Kang, one last thing I wanted to pick up, someone said that the person has Gilbert syndrome and thyroid. Is there something to worry about before taking the vaccination?
No.
Okay.
So I've
Great.
received a lot of questions around various kinds of conditions, including conditions that may be associated with prior receipt of vaccines. And so far, there is no evidence to show that any pre-existing illness or any bad reaction that you have had to food or drugs or other vaccines predicts that you will have a problem with the vaccines you take now. The only advice is, as I said, if you're currently ill, don't take the vaccine. And if you have a bad reaction to the first dose, don't take the second dose of that vaccine. The other important thing to remember is that if you are immunocompromised in any shape or form, then you need to take the vaccine, but continue to be careful. So if you're transplanted on chemotherapy with HIV, on steroids for a really long time, you need to be extra careful because your response to vaccine and your protection from vaccination may not be as good as somebody who does not have these conditions.
Thank you so much, Dr. Kang, for taking these questions. We will probably come back to you with few more, and thanks a lot for being there and uh, you know just relaying out. I think it's a lot more important to have these questions answered. We did cover a lot. Thanks, everyone. We will be circulating the FAQs and video snippets of this, so do watch out. Thanks a lot, everyone.